So it's when I walk.
The actual walking.
The actual walking, and it gets worse the further I walk. And it started about 2 years ago when I gave up an extremely stressful job that I loved, but it got more stressful and I snapped. And at the same time, I also became a vegan, so I didn't know it was part of that.
And it's the right hip, you said.
Right.
Yeah, okay. Show me what hip means to you.
In my sort of groin area, but it also hurts around here sometimes.
Okay.
And sometimes I get like toothache. That's in those areas.
Did you say toothache?
Yeah, like
radiating.
Yeah, I suppose, but that real deep.
Yeah.
Annoying.
Okay. And one more thing. So this started 2 years ago with this.
It was there before then, but it was intermittent. Every now and again, my hip would go, and I'd be like, "Oh," but it'd be fine. And it steadily got worse and worse. And in about the last 3 months, I've had to walk with a stick because I can't support.
You don't
my
feel
body.
that you can. Yeah. Okay. It feels like you will give in.
Yeah.
Does it feel like it's the quad that's going to give in?
No, it feels like the joint is going to go, rather than.
Okay.
Do you mean the muscle won't
Yeah,
hold me?
it doesn't feel like the muscle is weak. It feels like the joint is slipping. Is that what you're saying?
Do you know, I don't actually know the answer to that. I don't. I just.
Right.
I don't know if it's muscle.
If you lie down face up,
Yeah.
is there a movement you can do to create some discomfort in the hip?
Yeah. There is.
Okay. What's that movement? Show me the movement.
The moving my leg out. So that movement.
This way.
That movement.
Perfect. Lie down. Let me give you a pillow for under your knees.
Have you had any imaging or any?
I've had an X-ray. There is joint space, and there's a tiny bit of arthritis, but none that I can imagine would cause the amount of pain I've got.
What she's describing sounds much more like a tendinitis than arthritis. Okay. Those sharp shooting things are usually from, that kind of, what she called the toothache is much more likely to be the tendon of possibly the sartorius, Is this painful?
A little bit.
So this is painful. How about?
That is
Okay.
painful.
Okay. That at the pocket above. Okay. And go ahead and do the movement.
So if I lift my leg up like that and then do
This
that,
fine.
but the pain is really round the back and in the joint.
Okay. If it was hip, spleen 9 is your the hip point. It's the hippest of the hips. Okay. But I don't think she's hip. I really do think she's tendon, but we'll try. So just so here, right? Wait. Yeah?
There.
There. Okay. How's now?
No, it's gone.
It's gone. Okay, fabulous. If it's tendon, how's now?
It's also gone.
Great. And liver 8. Liver 4. Liver 8 for 10.
Yeah.
Spleen 9 for the hip. This is okay. We have only so much time. So now no. It wasn't chastising anybody. He was just explaining. So what I'm doing. This is really for dogma. No. The questions are fine. Hi. How's now? When I'm saying this is a demonstration of don't think, just do.
If you say the point, I just know.
Yes.
That's all.
Fair enough. Liver 8.
That's also gone.
That's also gone. Okay, next. She has some stomach chi, but I think, let's see, stomach 41 instead. Hi. No.
That still hurts.
Okay.
Still hurts.
Still hurts. Okay. So, because it's going to be hard for me to press all the points together, so I'll just needle them, see what happens when she rotates the leg and we have needles.
So do you think it's structural then? Because I thought maybe... there
No,
might
it's
be a
totally shin
hormonal-
disturbance.
Yeah. Constantly that.
Of course it's structural, whatever.
Well, I just wondered if it was
Sorry.
there was a hormonal thing because I'm of that age and I'm sailing
Okay,
through
there's,
menopause, but
okay. So in fairness, okay. For that I would have to check out, we'd have to do a little bit more and say, okay, there is a hormonal component, there is a this, there is a this. So yes, right now I'm saying let's see what we can do to get you out of pain, and maybe tomorrow we can look more deeply.
oh, thank you.
Do you see what I'm saying?
Yeah, I do.
So, because within half an hour to go through the whole process, it'll be a little harder. I also didn't ask you about your medical history, right?
Okay, yeah.
So I really am not doing what I'm claiming one should do.
Oh, okay. Oh.
I'm now doing electrica acupuncture. So, however they say that in Madrid, I don't know, but... I mean, this is like the quick and dirty, and if it works, that's great, and if it doesn't, you look deeper. Because sometimes, like there'll be times when they came 15 minutes late, whatever.
Yeah.
What are you going to do? You have to be able to work no matter what the conditions are. Well, you don't have to, but it's nice if you can.
So was that stomach 30, Avi, you were pressing around here?
No,
stomach
no,
30
it was
be
much more on the
higher,
thigh,
wouldn't it?
in my
Yeah,
opinion.
yeah, sorry.
It's here,
Don't get me
it's
an
already... No, it's hard to,
Yeah.
because, I would say stomach 30,
Yeah.
so I would say that's more like spleen 12.
Okay.
And now, so if you want a metaphor, so it could have to do with the autonomic nervous system. Now, she said the stressful job, blah, 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 blah. Because stress will come into here. So yeah, there is a component. Hi, how are we doing?
So it's sore, but
It's
not
still-
as much.
How much less?
50%.
Okay, 50 is something. Go ahead, if you don't mind, lifting and turning the leg out.
Ooh. Oh, okay. No, that action is much better. The
That action
lifting
is
it up-
related to liver 4, by the way. I don't know why, but it does. I can only say that it does.
But
But
pulling it back in and pulling it up that way was still as painful as it
yes, I understand. Because that suggests that it is the sartorius or the quads that are weak. Okay, that's just the suggestion. It's not a guarantee.
Because she had no oomph to get a leg up, as it were.
Yeah.
That's technically.
Yeah, yeah.
I'm getting a leg up. I said up.
Yeah.
Okay, lift the leg.
Ooh, that's loads better.
Ah.
Oh my god. That's loads
So people with knee issues, that's a standard thing that I do to lift up the quad.
What point is that then?
Spleen 10 and stomach 34, you can say it's more gallbladder, you can go more towards liver, more towards gallbladder, but it's at the level of about spleen 10. And you're basically needling it upwards, giving the quad a lift.
Yeah.
So on the bottom of the quad. On the bottom of
At the bottom, at the
yeah.
base of the quad, but
That's
above, somewhat above the knee, could have been even a little bit
Okay.
higher. Okay, and then I'm going to look for something on a stomach
That's
channel.
created, sorry to interrupt, that's created a really bizarre feeling down in the, I can't point because I can't sit up, but sort of down there, a kind of a twisting.
Okay, hold on.
Nice.
Just really unusual feeling. That's all.
Okay, it's a very, very, very clean jeans technique.
Don't look at this husband.
Don't look at this. What am I going to say?
Turn around here.
Turn around, it didn't exist. You're looking at the
I would
upper
have switched
part.
off if you said,
At least it wasn't his sock.
I didn't spit on the needle, okay? Look, if you want to tell me that no one else does this, I know everybody does this because I've seen this. I've been in people's clinics. I know what people do. You're looking for something somewhere between stomach 31 downwards, but in the upper half of the thigh where there's a like nodule feeling. That tends to help. Go ahead and lift up.
Ah,
What?
I can't even get it off the ground.
Where is it? So now it
Yeah,
hurts
yeah.
somewhere else. Oh, okay, okay.
No,
Okay, so it's a different story altogether. Hold on, let me take this out. Okay, go ahead.
yeah. Okay.
How is that? Wait, and turn out as well.
Oh, turning out.
Just everything.
Turning out is fantastic until I get
Fantastic.
there.
Okay.
But the lifting up was more difficult than when you grabbed.
Well, no. When you first lifted, I saw you had an effort,
Yeah.
so I actually pushed you. I pushed a little bit. I held. Sometimes you just give people 5% extra. Yeah, you're not really holding the weight, but just a little bit. It totally, the muscles can do things when they have a teeny bit of support. So they don't need a lot. So
I think that is better than very originally, but not as
Yeah.
good as when you were holding stomach 34 and
oh, got you. Okay. Any difference between the two sides?
That's more so.
Okay. Lift
Lift my leg.
the leg.
Oh.
Much
Oh
better.
wow.
Yeah, that the first bit comes really easy and then it starts
Yeah,
again,
okay,
but that's
fair enough.
brilliant.
Okay.
God!
So kidney 7 because it's going to be gallbladder 26. So first I do kidney 7. Okay. Now I do
Where's your gallbladder 26, Harry? Because I think I put mine a bit low.
take the navel
Yeah. Usually.
and go all the way to the side. And someone with her size, you can do 3 conceivably, since it was
I'll
like
just level with the navel, that's easy.
level with the navel is the only instruction there is for gallbladder 26. There is an instruction below the 11th rib in the textbook. That's garbage.
Yeah.
It's totally to the side. No. Originally it was totally to the side. It was switched at some point because of Li Shijian. And so there's like another understanding of it. Because the daima is supposed to start with a spleen mu. So you can't, if it comes from here, you can't go backwards and then forward. So they say, okay, below the 11th rib, go down to level of the navel. But there's no,
I know,
energetically,
I'll
there's
remember
nothing
that.
there.
Level with the navel.
Really. Okay, lift the leg and play, whatever.
That, oh my God, I think that's gone even further. If I wasn't wearing tight trousers, I feel like that would go even further.
It will touch the floor.
Yeah.
All right, one more. Okay.
Gosh.
Any discomfort?
No,
Any discomfort?
no,
Okay. Any discomfort?
no,
Or here?
no.
No. Okay.
Ow.
Okay, discomfort. And lift the leg.
That's better again.
Okay, so remember Sanjiao 22. Always add for any pain. I mean, always. It's a hyperbole or whatever that's called.
We're back to Shen disturbance now, aren't
Sorry?
we? We're back to Shen disturbance now, really, aren't we?
We're always in Shen disturbance.
Yeah.
The practitioner is always Shen disturbed. It doesn't matter what else is going on. The practitioner. So,
Life is shared as the
yeah. No. I mean, the thing is because it creates harmony, but also remember, we talked about it last year. There are all these Yamamoto points, all this Yamamoto scalp acupuncture. He has many systems. He's not one system. Okay. He has basic points here. By the way, he's not really scalp because he does a lot of things in the forehead. It's not exactly scalp what he does. But that's his original is here. But then he has a whole what he calls somatotopes because he's a urologist. He's not an acupuncturist. And he has a whole mapping of the body around the ear. Okay? And then he has a way to check it against the O. That's what I was trying to do. Remember I told you that if you have like around large intestine 11 pain, it means cervical. If you have around heart 3, then it's the lumbar spine. Okay, so I'm just checking to see if I can confirm it, and this one I can confirm which side I want to do, because sometimes it's actually the other side. Okay, but as a whole, I just say Sanjiao 22. Okay, and it's kind of like so if I can refine it a little bit more, that it matches the Yamamoto somatotope, great. But if it doesn't, still seems to work. Okay,
Yes. Thank you.
comfortable?
Yes, thank you.
Would you
Yes.
just only do GB26 one side?
Yes, in
Yeah,
general,
okay.
yeah. Okay, Moshu always both sides.
Yeah.
Why? Because you can't squeeze one side and expect an extension. GB26 is a twist. If you do both sides, you might untwist them in the wrong direction. GB26 generally, occasionally I'll do both sides, but generally I just do one side.
Okay.
It usually is the side of the problem, but not always. Sometimes the twist is on the opposite side, but the problem manifests on a different side that it does. But it's rare for me to do GB26 both sides.
Okay.
Mushu, always both sides.
And did you say
Until 10
combination
years
with
ago.
kidney 7 and a GB?
Kidney 7 first to release
Yeah.
gallbladder 26.
Oh, okay. Because it
Now
was,
remember the
was it
name.
tight?
Hmm?
Yeah, she said it was tight, sorry.
Yeah,
Yeah,
she
yeah.
said it. It wasn't super. There's worse, way more tight than that. Okay, so
If you
are you comfortable?
Yes, thank you.
I'll get you out before 6. No worries. Yes.
if you're using Mushu to release SCM, is it still both sides or just the side that's?
If I'm using Mushu to release the SCM, it's not because I'm using Mushu to release the SCM. I'm using Mushu to get them a sense of the pelvic girdle, which means I have to do it both sides, so they can release the SCM on their own, quote unquote. Because releasing the SCM, if I'm releasing the SCM, it's not like Sanjiao 8 that releases the SCM.
Right.
This is, I'm giving them a sense of core so that they don't have to do this.
Thank
There's
you.
a difference.
Yeah.
And I can't give them a sense of core with one Mushu. Okay? And you'll notice, if you watch what I do, for whatever reason, I can tell you exactly what the reason is. I like standing on the left side of the patient. I don't like, if her head is here, I would not feel comfortable. It just doesn't feel comfortable for me. So I always do Mushu this side because it's easier for me to needle this side. This side's because this is bringing the needle towards me, this is pushing the needle away from me. It's a lot more comfortable to pull the needle into you. Okay, it's just that when they're on the back, if I'm doing, I don't want, because I know she's sensitive, it's much more easy for me in this position to needle her left side because I'm pulling the needle towards me than her right side watos where I'm pushing the needle away. So it's just the mechanics. So when I'm doing Mushu, I'm usually doing left Mushu first and then right Mushu. There's nothing mystical about it. There's nothing special about it. It's just convenient. So I'm usually checking the left Mushu against wherever it is. Right side, left side, blah, 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 it doesn't matter. But I'm going to needle both. Because what am I supposed to do? Go like this and go in, how's the... I can't use both hands on Mushu, and then I have no capacity to check anything else. So therefore, I'm only checking one Mushu, but I'm always needling both. Make sense?
Yes, it does.
Okay. Now I have to get back with you. Sorry. And we wanted to do stomach now, right? And someone was not being responsible because we wanted to, Anna, there was something we wanted to check and now we never did it.
It was Sanjiao 2, but you
There was
said
not
no.
until we decided it wasn't really right, but there was something else we wanted to check, but I can't remember what it was. But it doesn't matter, she's gone.
I think you did do blood at 26.
Sorry?
62, you did do it.
Oh, it was 62, okay. All right, then we were responsible.
You were responsible.
Let's have you turn back onto your back. And we'll do stomach 9. You don't have to do it. You can let go of the chin. You can let go. You can let go of the chin. No, you can try to expose your neck, but it really isn't necessary. So I tap it in, and then I go slightly down. So I'm going under the SCM. And this way I'm making sure I'm going away from the, you don't have issues about aorta, blah, 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 blah. How does the shoulder flow now?
not hurting, but it
Yeah.
still feels kind of
Stuck.
Weird.
a little bit. Yeah.
Okay, that's good. Okay, hold on. Let's see if we can get more mileage. And
It makes it hurt.
that makes it hurt. Okay, no, okay. No,
Nothing.
Hmm?
It still makes it hurt.
okay. What does it feel?
Ow, that hurts.
The knee? I'm sorry.
No.
And how's the shoulder?
Yeah. I still kind of feel sort of stiff here,
Okay.
and that hurts.
I'm sorry about that. Can you ignore it? I know they're very close, but how's the shoulder?
It makes
Me pressing here might make some radiation down the arm, but
yeah,
no.
it makes it hurt a little bit. But
Okay, hold on one second. Can I stick it
maybe a fraction a little bit better.
Fraction. This is the scalings basically, so which is the blood and nerve supply into the shoulder. Are we done?
Mm. Maybe a bit better.
You already did that one, I'm not doing it. Did we?
No, I don't
Yeah,
know.
okay. Okay, then we have another opportunity. Oh, there was someone, was Anna. Okay, go ahead. How's your shoulder?
It's still quite stiff here.
Quite stiff.
Yeah.
You didn't do spoon 9, I don't know.
We did. No, we did liver. Okay, yeah. That was my next possibility, but let's do. And now.
It's not any worse.
Well, okay.
I think as well, like when you're doing it and it can be stiff, and then if I move it a little bit, it kind of loosens. I don't
Well, you're moving it to test it, right?
like I'm moving it to make it feel better, but
Oh, you're moving it to make it feel better. Oh, okay. So in other words, you don't have to move it to test it.
okay.
So then don't, no. So then don't move it and just tell me
Okay.
how it is, okay. Because I'm waiting for you to move it because I thought that's how you test it. Okay, but you
Okay.
can actually feel it without, okay. Now.
Maybe a little bit.
And now? Yes, no, yes.
I don't know. I can just feel kind of as though there's some kind of not release, but sort of like it feels as though there's something moving there.
So you kind of like it?
Yeah.
Okay.
But I don't know if it's getting down as far as my shoulder.
Oh, okay. How's now?
My shoulder's not changing.
Okay, so this one didn't contribute, okay. But this one is. The face one is. You said it changed something.
It made me feel stuff here, but not actually where my shoulder
Oh.
is, or whether there's a...
And now. No? Okay. Well, we'll stretch it out afterwards. So we'll just add, because you did say that small intestine 18 did something. The reason why small intestine 18 is it's the meeting point of the arm sinew channels, the young ones. Everything is in place.
Trying to scar you lot for life.
Okay, let's have you sit up and walk and tell us how it feels.
I'm already feeling that.
Okay, let's do the real thing. Do you need your cane?
No.
It's a miracle. She can walk.
It just feels really good.
So sometimes tricks work better than thinking. It all depends on the patient. It has
There's
nothing
still
to do.
pain.
No,
My God, it's loads better.
Yeah, good. All right. Well, if we have time tomorrow, we'll try and see. I can. But your shoes are still here.
Yeah.
Is what happens when they don't work, and that's really what I'm trying to emphasize. So in her case, we didn't have an opportunity to do that. So, right. Any questions? We'll wait a few more minutes with you. Why don't we? Oh, we were somewhere else in this. Yeah, I think. Oh, yeah. And that is the picture didn't work. Okay, so. So we talk about gallbladder 39. Okay, so inner yin you've seen a lot. Okay, and it's not an official point. Okay, but it's a very important area. Number one, it has to do with the hormones. Number two, it supports the pelvic floor. Originally, when this point came out, it was a trapezius releasing point. That was the official, what it was supposed to do. It releases the trapezius. And finally, it's a point for constipation on the left side. Why? Because the descending colon and the adductors kind of come together. Okay? So, bladder 66 we also saw as a hormonal point, and the reason why, so you have there's a few things to match here. First of all, by name, the tongue gu, okay? So gu is valley, but gu is also the food, right? Like Gucci, that's, even though that character would be used for sure. I'm pointing to a computer, but I shouldn't be pointing there. That character is also, the valley, the essence of the food. Okay, so in a sense that's, you could say that's hormonal, but tongue is to penetrate, to communicate, like an ambassador is a tongue. Okay, what do hormones do? They communicate. Okay, so that's one. The other thing is small intestine 3, we say, is a point that relates to the pituitary. Okay, now, behind DU20 and in front of DU20, we have 2 points that are called before and after the vertex. Okay? Small intestine 2 and small intestine 3 are also called before and after. Okay, they also have the same character. Okay, so the hu is behind, and I think it's xian on small intestine 2. So small intestine, this area of the small intestine seems to be related to the top of the head.
So what was up here?
You have DU19 and DU21. Around DU20, you have before the vertex and after the vertex. Okay? You have the same character of before and after on the small intestine 2 and small intestine 3. You can interpret it in a number of different ways. One of them you can interpret it related to the small intestine itself, because the small intestine itself, there's a before and after the duodenum kind of thing. You know, before the duodenum would be before duodenum, jejunum, and what's the ileum. Okay, so you can interpret that as referring to the three parts of the small intestine. And you can ask, what do you mean by before and after? Before and after what? That's kind of an interesting question. But I'm relating it because the large intestine channel also has second space. The large intestine 2 is called erjian, and large intestine 3 is called sanjian. Second space, third space. So it seems like in both the small intestine and the large intestine channel, there's a reference to the fact that they're relating to an organ that's multi-layered. Okay? But in this case, when we're looking at the small intestine, what I'm saying is that this area seems to be related to the top of the head, which is why, presumably, they decided that small intestine 3 opens the do. They were not thinking of it opening the do in the low part. They were thinking of it, presumably, in the neck and upwards. Okay? And it's a point that's very good for women who've taken birth control and have had problems with the birth control pill, or are having problems now, and when you put small intestine 3 in, everything seems to release better. You've tried everything you could, nothing really moves, but adding small intestine 3 really pushes the treatment. We believe that small intestine 3 treats the pituitary. UB66 and small intestine 3 are obviously brother and sister points. One is the foot one and one is the hand one. Therefore, you know, I'm just giving you different ways to look at UB66. It's also a good point for tailbone injuries. Okay, so, and UB36 we just saw also. So again, the name, you know, to support the support, it's a really useful point for back pain. So you asked for back pain. Although Kawai didn't use UB36, he went 2 fingers below UB36. I think it's more because they didn't want to get into people's underwear. You know, I think it was just, you know, take it lower is better. But I really do think that the actual insertion of the muscle is very useful. And pretty much on any structural issue, I will start using UB36. You know, I would start looking at it. Okay? So let's take your needles out. And let's have you sit and face the stretches. Thank you. See you tomorrow. Do you want to shoot?
Yeah, please, thank you.
So we're going to stretch her neck out and stretch out the scalenes, and then let's see if the shoulder feels a little bit more willing to come into place. So we'll start on the easier side. You're pushing back a little bit. No, you are pushing back. Don't push back. Don't push back. I'm going to push you forward. Okay, good. So I want you sitting on your thighs, not on your buttocks. Okay. So, it's loose, okay.
I mean, obviously it feels no.
There's nothing obvious in medicine.
At the moment, it feels okay.
Okay, but you're worried that it won't. You know, I mean, because you know the feeling. I know what you're saying.
Pushing down and I know that I can be lying there for a few seconds and think I'm comfy, but then another few seconds it changes.
Yes. Well, I mean, fortunately or unfortunately, all we have is what there is right now.
Mm-hmm.
So what will happen in 50 seconds will happen in 50 seconds. You know what? But let's enjoy what there is now.
Mm-hmm. And gradually it's kind of getting heavier and heavier again, you know that?
Gotcha.
Yeah.
All right. One thing you can do, possibly, is when you feel that it's coming up, what I want you to do is just drop the chin and bring it back up. Now, don't drop slowly. Just drop it and bring it up. Because it kind of, so that you really, well, you bring it up to here, I'm exaggerating. Just bring it up to straight. So drop the chin, and bring it up. That's good. That's all you need. So to release some of the tension here. Okay? All right, thank you for coming.
Thank you.
Thank you.
Thank you.
All right, any questions before we leave?
So I found it quite interesting, we didn't use spleen.
On her?
Yes.
Yes, because, well, there was a certain amount of rebellion here. We already used spleen on everybody else.
Oh, I see. I just
She
thought,
might have
with
been a spleen
the
type.
sensitivity stuff, I was thinking with the weight, that's the only other channel that goes.
To the heart.
Yeah.
Yeah, but all these things are not nice excuses.
Yeah.
No, I mean, you can make all the rationalizations you want about reasons of why you use things. At the end of the day, no, I mean, she could have fitted into the spleen 6, spleen 9 pericardium instead of what we did, which was liver and pericardium, and maybe next time you forgot something. Oh, the socks.
Sorry.
Your socks are right.
Thank you very much.
You're
Is that your watch?
Oh, yeah, I know
Yes,
that.
it's a Fitbit, I think.
Thank you very much.
So that's why, you do a treatment and you let them come back. When they come back, they give you feedback about how effective the treatment was. And then you say, oh, I totally screwed up. Or you say, oh, well, that's cool, that's good enough. You don't know what it's going to be like until they come. The treatment is not over until they come back and give you feedback. And which is why I personally don't charge extra first treatment. If anything, I should charge an extra second treatment, because that's when I'm really doing the work.
Yeah.
So I don't, because I think it's not fair. But it's a business decision. It has nothing to do. I'm just saying, people tend to think first treatment is the big thing that you're doing all your analysis. No, it's actually often the second treatment, because part of the analysis is how did they do with this treatment. Otherwise, if you think that you can evaluate in the first treatment everything, you're saying that the results don't matter. The results are the only thing that matters, so there's nothing to evaluate until there are results. All I'm saying is that if the abdomen cleared and the neck cleared, etc., there's a good chance that the symptoms will go away, but that's not true for every single person. So you have to accept that that's how it is. Okay? Anyone else? Are we going to dinner?
Yeah, there's 10.
There's 10 of us. Oh,
Well, Rumen's wife and child are here.
oh, okay. So, and you guys can, you can ask questions at dinner also. So it's not like- No, I'm totally fine with it. So, I don't know if your wife and kid will be interested in questions, but we'll find out.
Anybody got any suggestions where?
Oh, we haven't figured it out yet. Oh, okay.
It's not very easy to find a table for 10, really, isn't it? So it's only going to be
It's the Chinese or the big tie, isn't it? Probably. Yeah. Well, should we just head off in that direction and go to the first one and then...
You could go to Red Chili, couldn't you?
Is that not terribly hot? It sounds like it ought to be.
No.
Oh, is that the Chinese?
Big Chinese.
Oh yeah, no, that was great, that's great.
I didn't know they'd do a table for 10.
Yeah. We had 10
Is that the
last
one
night.
towards the railroad station kind of thing?
Yes.
Yeah, more or less, isn't it?
Which direction are we facing? That's the road.
I think so, yeah. That's,
You turn right.
don't
left and it's
put
on
me
the
as the
left.
organiser of anything.
Yes, I remember that.
It has plenty of vegetarian.
But,
Does that sound good, isn't it?
then I'll give them, I'll see, is there internet here?
What?
Is there internet in here?
Yeah, the split roads up there, Ziggy, and then A1, B1, B2.
Oh, right, okay.
Just select Ziggy, put in A1, B2, C3. The alternative would be to go to the World Buffet, but
Where's that?
that's just round the corner. For the, it's one of these where you go and help yourself. They have hundreds of dishes, and they'll fry you up something, but it's probably not. There's quite a few vegetarian things, but it's very much orientated towards meat eaters. I think it's a fixed price though. It's 15. I think it's $15.95.
You know all the restaurants here.
No, only because I ate there last night. It was very nice because you can choose what you like. You see, so you don't.
It's a different price today. It's the weekend.
Might be more tonight. Yes, it might be. Sometimes they put it up like that or something.
But they're not stupid.
Sorry?
Just wondering why it has specific concentrated.
Well, because A is 1, it isn't. B is 2, C is 3rd character, D is 4, and E is 5th.
Yeah, but I mean, there's a lot to put in.
But it's easy if you set the, if you lock your thing in uppercase, then it goes in easy.
I was trying to...
take your suitcase with you.
Oh, yeah. Yeah, of course, otherwise you can't come and, get it back. Where are you staying?
Not that. I've probably put it against college.
No, Ziggy. Against Ziggy.
So the thing is, the red cherry is the
Oh, she's there.
I must remember, because on each side of the red cherry there's a time restaurant, which is also quite big.
He's got lots of space for us.
Not too late now, is it?
Um,
Straight down.
Tim?
No, it's about to try it.
Because one of the reasons I said no was I've got the last train is 22.
Tim, can I just ask you?
Hold on, Tim, you're being asked.
What's up?
Did you, it seems to be
We're
playing...
going to go straight now, but
Oh, no, it's...
Yeah, they need to go soon because it says...
Well,